So today we're going to be talking about the spinal cord. How many of you guys feel comfortable talking about these tracks here? Yeah, kind of? Okay, well this will be a good review then. The first thing that we'll talk about is cord development, and this is on the first sheet. Basically, the cord develops caudal to rostral. At birth, the cord ends at L3, but by about 3 to 4 months, the cord will end at L1, and it'll stay that way through adulthood. The nerve roots remain in the same foramina even as the canal lengthens. And basically, in the cervical vertebra, the nerve roots exit above the osseous segment, and below that, it exits below. You guys all remember that from class, right? Okay. The dura doesn't anchor like the foraminifera do. They anchor at the foramen magnum and at the S2 terminale, as the filum terminale. The dura is sensitive to pain, and that becomes important clinically. And then the pia mater gives rise to the dentate ligament, which pierces through the dura, and it anchors at multiple levels, and that just gives a little bit of strength to the cord. Cool? Okay. So, looking at a few things, you have your anterior spinal artery here, and you have two dorsal spinal arteries that come right about here. And that again is going to be important significantly or clinically, because when you have a rupture or any kind of trauma, then this is going to be important. Okay. Looking at it, if you cut the cord, so this is a cross-sectional cord. If you look at it here, you have the posterior side and the anterior side. Your posterior side is known as the alar, and the anterior is known as the basilar. Posterior cord is going to hold mainly the sensory. And your basilar is going to hold more of your motor. Now, if you see sensory in the anterior section of the cord, that means that it's a decussating pathway. If you see motor in the sensory on the posterior portion, then that's going to be a decussating pathway. Cool? Okay. So who knows what this one is? Dorsal what?
All the dorsal column.
Yes, so both of these are the dorsal column. This one specifically is the fasciculus gracilis. And that's going to basically be from T6 and below. Whereas this one right here is known as your fasciculus cuneatus, and that's going to be T6 and above. So you're basically looking at cervical, thoracic, lumbar, and sacrum. So a few of the spinal cord rules is basically you can kind of look at it as getting on the bus and getting off the bus kind of analogy. So when you're looking at getting on the bus, you want to fill from the back to front. Basically meaning that the spinal levels are going to be, the lower spinal levels are going to be more midline because they're the first to get on. So they're going to come in here and go up, whereas if you're coming from the upper body, it's going to come more lateral and go up. And then when we look at the motor pathways coming down this way, it's going to be the opposite. If you're getting off the bus, the first one getting off needs to be closest to the door. So you'll find that it's going to be the opposite. You're going to have more of the sacral segments being medial and the upper extremities being more lateral. Yes? Okay. Who knows what this one is? So this is your anterior cortical spinal tract. anterior spinal thalamic tract. Sorry about that. Okay, so your anteriors. Sorry, let's go back to the dorsal columns and look at the fasciculus cuneatus and the fasciculus gracilis. What do those do?
The sensory for the motion.
What's that?
Sensory tract for the motion.
Yep. So they're going to basically deal with conscious proprioception of the limbs and the trunk. So this is going to be your accurate touch, your joint position touch, and your vibration tactile sensation. Okay, now we'll go back to the spinal thalamic tract. This is going to mediate pain and temperature. It's going to, the more anterior portion is going to be more of a light and crude touch pressure type of receptor. And since this is sensory, but it's on this part of the anterior portion of the cord, what does that mean?
Decussates.
It decussates, and it decussates at this segment, and it goes up. Whereas these ones stay pretty much on the ipsilateral side up until it gets around towards the medulla, and then it's going to cross over.
Did you change the label?
Oh,
Messing me
yeah,
up.
thanks. So this is your anterior spinal. Okay. And then we've got the spinotectal tract. And there's more detail inside of the packets, but I'm just not going to go over that right now. So your spinotectal tract is going to be right here. And who knows what the spinotectal tract does? Very good. It provides an afferent input for spinal visual reflexes. So you have a reflex that basically when you hear a loud noise or when you have a light stimulus kind of coming right here, your eyes and your head are going to look towards the stimulus at the same time your body's going to go to run away from the stimulus. Make sense? And this is the sensory input for that reflex. You also have your spinal olivary tract, and that's going to be right here. And this one is basically, they kind of feel like it's unknown, but they're thinking that it has a feedback mechanism for the neck and eye movement, and that it can play a heavy role in vertigo. So that's kind of interesting. The next one we can talk about is the, let's go dorsal spinocerebellar tract, and that's going to be right here. And who knows what this one does? Very good. Okay, so the dorsal spinocerebellar tract is going to be unconscious proprioception from the legs and the lower trunk. This is talking about muscle spindles, GTO, touch, and pressure receptors. And your anterior or your ventral spinocerebellar tract is going to pretty much be the same thing. It's also unconscious proprioception, but this is going to be for the trunk and upper and lower extremities. Okay, now let's go ahead and get on to the motor side, and I'm going to come on this side for the motor. Who knows what this one is?
Spinal tract.
Very good. And what does that do?
Volitional movement.
Volitional movement, good. This is going to be volitional movement for the hands and the feet. And remember again, we're going to be looking at the bus rule for this one. So the more midline, you're going to be looking at upper body and hands. And the more lateral, you're going to be looking at lower body. So it's going to kind of be like this. Okay, the fibers are going to come from below here. I'm sorry, it's going to come like this and go out, and then the cervical is going to be more midline coming out. Okay, and then what's this one? What's that?
Is it rubro?
It sure is. And what is rubro?
cerebellar reflexes?
It sure is. It's going to be dealing more with the exciting the flexors of the upper extremity. And then what's this one? Reticula? Did I hear that? Yep. Reticulospinal tract. And this is where you're looking at the fibers that carry out the PMRF. We talk about that all the time. They've got the 4 actions of the PMRF. I'm not going to go over that because we go over it all the time. And it's also concerned with cerebellar reflexes as well. Okay, and tectospinal, where's that? Anybody? It's going to be this one right here. And who knows what the tectospinal tract does? Now we're getting progressively quieter. Okay, the tectospinal tract is going to be the same one that we talked about when we were over here. You're looking at the visual reflexes. So now this is going to be the afferent division, the carrying out division of turning the head and neck towards a sound stimulus. So if you hear something here, you're going to turn your head and look at that stimulus at the same time your body's going to turn and run away from it. So it's a very, very important reflex. Olivospinal tract is going to be this one here. Same thing, they're not totally sure on the function, but they think that it's a feedback mechanism for that same reflex that we just talked about. This one right here is going to be the vestibulospinal reflex, or vestibulospinal tract. And this is looking at equilibrium and anti-gravity muscles. So this is going to be dealing with the proximal extensor muscles. So what holds your body up and keeps your posture and keeps you grounded in gravity. This one right here is just your anterior cortical spinal tract. Very similar, it kind of goes along with that. Any questions? No? Okay. Well, that's all I really had planned to talk about for today, and then tomorrow we're going to go over a little bit more clinical kind of applications, but do you guys have any questions as of right now? Thought that would take me a lot longer.